which of course is for those who perhaps somehow have not gotten to know about this, is a social health insurance scheme that has been, designed to provide quality healthcare to all Lagosians at very, very negligible cost. The saying goes, health is wealth. And I just want to ask you, what does this really mean to you and your family? And, well, if you can just give me your attention for the next few minutes, we'll definitely show you how you can take advantage of ILERA EKO to make sure, uncertainties don't take you at an unexpected time. So just do me one favor, let's get started on this. Join me in the conversation and let's see how ILERA EKO can, make things work for you as per your health and your health of your loved ones. Stay tuned, and of course, as we together, make Lagos a healthier and happier place, one conversation at a time. All right, as the show progresses, we'll definitely be giving you traffic updates to help you navigate effectively. Today, it's all about the payment process for ILERA EKO, but that doesn't mean, for those who perhaps do not know what ILERA EKO is, that doesn't mean we'll not talk about this. We'll definitely give you information about ILERA EKO, first of all, and because as I said, it is quite surprising, but a few people actually do not even know what we're talking about. I will let you know what it is, why it's important for Lagos residents, and from there we'll go on to the payment process. Of course, we are big on feedback. We definitely want to hear from you. So if you have any questions, you have any comments, you have any inquiry, or perhaps you're not clear about something, feel free to connect with us. 091-538-77127. We definitely would love to hear from you. A quick traffic update, and I'll be introducing my guest on the show. All right, this is the Ekpe axis. It's good. Mojoda connecting Tamaro, Itaopo, and Ayetoro. Ayetoro towards General Hospital Junction, linking T Junction, Temu, all the way down to K2. Is it also encouraging T Junction connecting Alaro City all the way through to Ibeju, Car Market, Eleganza, Kaitoro, and Eleko Junction. Return journey Eleko Junction is also very good down to Car Market, Ibeju connecting T Junction all the way down to Okeosho and K2 Ayetoro. All the way down that stretch is good down to Mojoda. All good at this time. No impediments as we speak. Now, our own K2, the K2 we know, talking about K2 Ojota, there was an earlier report of a broken down truck at K2 inwards Ojota. Well, that has finally been towed off the road, and normalcy has returned to that stretch. All right, on the show this morning with me, yes, we have Mr. Olafimihan Oladapo. He is a sales officer with the Lagos State Health Management Agency, and together we'll be, talking about the ILERA EKO payment process. It's so good to have you with us, Mr. Oladapo.
Thank you, sir.
All right, please come closer to your microphone, and because I'm sure Lagosians have,
okay.
Yes, a little closer, a little more closer. Yeah, that's good. Thank you so much. So I hope traffic wasn't much of a bother for you.
No, actually, I left very early, sir.
Okay.
No, I
Great.
was able to beat the traffic.
Yeah. Okay, so it's a great having you with us. And yes, like I mentioned in my intro, we still have people who still ask questions.
Okay.
I was opportune to be at a gathering, say a couple of weeks ago, and we had one of your representatives, come make a presentation, and while he was talking, I noticed that a lot of people had questions, and a lot of their questions it mirrored the fact that there are still a lot of people who do not have a clear-cut idea of what this is all about. So let's just start from the very nitty-gritty. Let's start from the basics.
Okay.
What is ILERA EKO? What is it, and why is it important for Lagos residents to come on board with this?
All right, thank you very much. ILERA EKO is a social health insurance scheme by the state government, and this really gives access to affordable and quality healthcare services in Lagos. And the reason why this healthcare is actually good is because one, it is affordable, so you don't need to probably stress yourself when it comes to healthcare facilities. And again, they make it so simple in the sense that you can walk up to our kiosk, come to our office to get registered, and have a policy. And the fact is that health is wealth. So you have an insurance, give you more reasons, to use hospitals, for health checkup and all that, rather than doing the other way. So it
of course, that's quite expensive doing it the other way.
Exactly, it's quite very expensive. But coming under ILERA EKO, it makes it more affordable, and you can have access to very quality healthcare services in the hospital.
Amazing one. Okay, so of course you mentioned that it's for Lagos residents. Does this mean someone who stays perhaps in somewhere like Mowe cannot have access to this?
Actually, it all depends their facility which they want to use.
Yes.
Apparently, we have people coming from Mowe that access care in Lagos.
People that stay in Ota.
Exactly.
People that stay in Songo.
They have healthcare. They have healthcare facility that is very close to them as well. So I could believe we have many of them on the ILERA EKO plan. Yeah, on platform. Yeah, that uses it.
Okay. So that means they can also be part
Definitely,
of it.
they can be part of it.
Okay. So let's talk about what we get to benefit for those who who are on board and for those who want to come on board. What are the numerous health benefits to be enjoyed when I enroll on ILERA EKO?
Okay. As I've explained, ILERA EKO, it is an health scheme, and it has a lot of opportunity, health benefits. Which one is it covers for general consultation. If you want to use the hospital for general consultation, it's covered. However, it covers for special consultation as well. Up to 4 visits in a year. Also, it covers for physiotherapy section. That is up to 5 visits in a year. It covers for admission.
Okay.
That is 15 days admission.
That's like 2 weeks.
Yeah, exactly. 15 days in
plus
a year.
1 day.
Also, it covers for child ailment. Yeah, it covers for child ailment. It covers for treatment of common ailment as well, like malaria, typhoid. All these are one of the benefits which an elderly is meant to enjoy in that area. It covers for family planning. For those that feel they've had it or they don't want to have a child again. It covers for family planning. It covers for hospital care and admission. I think I've mentioned that.
Yes.
Yeah, so it covers for
15 days.
15 days, exactly. It covers for pharmaceutical care. That is to get some drugs under the scheme. Is as well covered. Also, it covers for chronic disease like diabetes. It covers for asthmatic, BP. All these are much covered under ILERA EKO, and they are chronic in it. Kills very fast. Also, it covers for laboratory investigation. That is laboratory tests in one text. Is as well covered. It covers for X-ray, like one of those chest X-ray. It covers for dental care. It covers dental care. It covers for eye care. Eye care to the point of 10,000 naira limit for frame and lens. Yeah, it's covered. Yes, it covers for emergency services. Apparently, it requires an emergency. It wasn't planned. It has well covered under the scheme as well. So also it covers for surgeries. For surgery like cataract surgeries is covered under the scheme without you paying.
Cataract surgery.
Exactly. Yeah.
Incidentally, last week Thursday was World Sight Day, and yes, ILERA EKO covers for that. The cataracts, because that's like a major cause of blindness.
Sincerely, exactly. So it's covered as well.
And we all know what cataract surgery. Well, the cost.
The cost for the cataract surgery.
Yes, it's quite a lot.
It's a lot. It's a lot, and I even think it's major.
Yes, that's major. It's a major cause of blindness, especially in Nigeria.
Yes.
Okay, and then Africans. Yes. So please go on. I'm sure you're not done.
So also I say it's covered for some surgeries, cataract. It covers for hernia surgeries. It covers for breast lumps. It covers for goiter. And like that, like common surgery like that, so it's also covered under the scheme. So until when they come on board, so we can also review more to them, so they could know. Also, I say it covers for dental care as well. It covers for scale and polishing. It covers for tooth extractions. Also, tooth X-ray as well covered under the Lagos State Health Insurance Scheme. Very much covered. However, it has numerous benefits, which if I start to mention, I don't think we'll leave here today.
Right. So these benefits, are they all on all the plans, or do we have for separate plans? How many plans are available? And let's just talk about
Okay, the plans are
available. Yes.
we have different plans. We have a Jara plan, we have standard Jara plan, we have standard Jara plus plan. Also, we have senior plan, we have student plan, we have a numerous plan.
Say again, we have the standard Jara.
Jara, yes.
Okay, and then you mentioned
we have a Jara plus.
standard Jara plus.
Yes.
Okay, Jara is plus actually. So standard Jara. Standard Jara plus. So what's the plus again on the Jara?
The plus is additional benefit. Yeah, it gives you, okay. Now, for instance, on the Jara plan, it is 15 days admission. Quite all right, right?
Yes.
On the Jara plus, you have 21 days.
21
admission.
days. Okay.
Now, on the Jara doesn't cover it for private work.
Somebody,
but the Jara plus, it covers for semi-private.
Somebody sent a message. Allow your guests explain ILERA EKO for us. So I'm interrupting you. Okay, so please.
Okay.
Okay, please go on.
All right. So I'm saying we have Jara and Jara plus. Now the difference is just that it is in terms of the benefit.
Okay.
Which I'm trying to explain. So
yes.
on the Jara plan, we have 15 days admission on the normal Jara plan, but on the plus it is 21 days admission.
Okay.
On Jara plan, it doesn't have access to private ward. But on Jara plus, you have access to semi-private ward.
Okay.
You understand? So the difference is in terms of surgeries also.
Okay.
Yeah, like that. It's in terms of surgery and some other medical treatment.
Yes.
But just that, when it comes to the payment, some people tend to go for Jara, looking at the payment differences.
The pricing and all that, yeah.
Exactly, yeah. But as well, we also have senior plan. Senior plan is for people that are 60 years and above.
Okay. What sets seniors plan? Why is it different from the other?
It is different because, the plan is actually designed for our age parent, people that are 60 years and above. Apparently, definitely some email can just pop up without, as a result of probably their past ways of life, what they've eaten and all that. Yeah, exactly.
I'm not there.
So sometimes that's why the plan is quite different. It adds some additional health benefit for age parents.
Yes.
Like them doing mammogram, them going for CT scan, echo scan and all that.
Yeah.
We all have that encompasses in the senior plan.
Okay.
For the senior citizen.
All right.
So the plan can only accommodate just 2 people. The principal and spouse.
What's the pricing like? How much is that?
Okay, for the senior plan is 60,000 naira for one person.
Okay.
Then
60
for couple is 100,000 naira.
100,000 naira. Okay.
So the plan can't accommodate more than 2 dependents, principal and spouse, or principal alone. So it's just 2.
So someone who is maybe below 60, but wants to enjoy all the things that comes with the seniors plan.
They can as well subscribe to it.
They can subscribe to it.
They can subscribe to it.
Okay, it's not like you have to show your birth certificate or something.
All those are optional.
Okay. So the question, there's a question that begs for attention, and that is for those who perhaps do not have that lump sum to pay for, say, the standard Jara plan or standard Jara plus. Are there arrangements? Is there any provision for people who does not have that lump sum to pay?
Okay, like to
paying bits or something.
Actually, for now, no.
Okay.
Everyone that wants to come under the scheme are meant to make full payment.
Okay.
Full payment. There's no privilege. We don't do pay small anymore for now.
Okay.
So for now, it is full payment. If you want to come on board, ready to make a full payment once.
All right.
Okay.
Okay. So we'll take a quick break. We'll take just a short break, and when we come back, we'll take it to the next level. I'm sure a few people want to know about the registration details. What's the process like? What are the requirements for registration? And perhaps if you have any question, 091-538-77127. That's the number to call. Or if you want to send a WhatsApp message, it's 080-991-20777. I'll be right back.
ILERA EKO,
And we have Mr. Olafimihan Oladapo, who of course is a sales officer with the Lagos State Health Management Agency. He has been taking us through the ropes, giving us an insight on what we get to benefit and enjoy coming on board with any of the plans on ILERA EKO. And he's been able to, clearly show us why we should come on board, the things will benefit. He mentioned that we have the standard JARA plan, we have the standard JARA plus, and we have the seniors plan, which of course is quite robust. Yeah, of course you've been able to tell us the pricing for the seniors plan, but if people do not know how much the standard JARA plan is and what the costing is, and are there, let's just talk about that for a bit, just before we talk about how to register.
All right. Okay. So I said we have JARA and we have JARA plus. On the JARA plan, a single is 15,000 naira.
Just for one person.
Yeah, for one person.
Okay.
Per annum.
Yes.
And we also have on the same JARA plan, we also have family of 4 and 6.
Okay.
Now for family of 4 under JARA plan is 55,000 naira.
So family of 4, father, mother,
and 2 children.
Okay.
Below 23 years.
Below 23.
Yeah.
So if they're above 23,
mother,
they cannot.
They can't come under the family. They will need to come under the single plan.
Okay. It's fine.
So we have father, mother, and 2 kids, or father with 3 kids,
okay,
or mother with 3 kids below 23 years.
23, okay.
That's 55. Also, we have family of 6,
okay,
which is 80,000 naira.
Right.
For father, mother, and 4 kids below 23 years, and or mother and 5 kids below 23 years.
Okay.
She understand. And also, for additional benefit, added extra 10,000 naira on each dependent.
Okay.
Let's assume we are going for family of 6, that's the max, which is 80,000 naira.
Yes.
And apparently we have father, mother, and 5 children. That's 7. So instead of 80, they added extra 10,000 naira on the additional dependent.
Okay.
Then follow where that they are below 23 years.
Okay.
So it's that actual extra 10,000 naira on the payment. Makes it 90,000 naira.
90,000.
And also we have for the JARA, JARA plus.
Yes.
Now, for JARA plus single is 40,000 naira.
As against 15,000.
As against 15, exactly. As against 15,000 naira.
Okay.
So that's 40,000 naira for single on JARA plus, and for family of 4 is 146,000 naira. For family of 4, that is father, mother, to below 23 years,
yes,
or mother and 3 kids below the 30 or 4 and 3, that's 146.
146.
And we also have family of 6 for JARA plus.
Yes.
That's 220,000 naira.
Okay.
220,000 naira for family of 6. That is father, mother, and 2 and 4 children below 30 years.
Right.
Exactly. So that's the price.
Okay. So just before, while the break was on, of course, we were discussing something off air. I was asking you that people that cannot pay that cannot pay this lump sum, because for some of these plans the amount, even as affordable as it looks, for a few people it might still be hard. Are there any arrangements, whatsoever, LASHMA, anything?
Okay. I think for those that could not probably make a one-time payment, they can come. They can actually pay small.
Okay.
But they need to come under the ILERA EKO cooperative.
Okay.
Yeah.
Okay.
So they can actually pay for people.
So they have to
Japan,
join the cooperative.
They need to join the cooperative for them to enjoy the pay small benefit.
Okay.
And for them to do that, they will need to visit our office at Alausa. Yeah.
And they get the forms.
To get the forms and join the cooperative, then they can enjoy the pay small benefits.
All right.
Yeah.
So let's talk about registration. Okay, I have a question here. This person says for this. Okay. Good morning, Amisa. Okay. Good morning. Please, what can your guests tell us the tests available for the seniors plan? Okay, that's what this person is trying to say. And then another question, please. This is another person. Do you mean we can't register our child below 3 years? Okay, I don't think this person. Child below 3 years. Okay, I don't. Two questions. So let's talk about the seniors plan. The tests. Can we get
so for the seniors plan test, well, I said the difference between the senior and the JARA is the text which
yes, quite comprehensive.
Comprehensive, and that is echo scan. It is quite very expensive.
Okay.
We don't have the echo scan on the normal general plan.
Okay.
I said it's also covered for CT scan.
CT scan.
Yeah.
Okay.
So it covers for PSA.
Okay.
Yeah, for probably those that have prostate.
Yes. Okay. So prostate is covered.
On the senior plan.
Okay.
And I said it covers for mammogram. I think it's the test for female to probably check their breast.
Yes.
So those are the tests which we have for the senior citizen.
Okay.
Under the senior.
Okay. So my listener, to attend to the other question about the child below 3 years, I don't really understand that question. Could you elaborate more just before we end the show so that I would really understand your question? Let's talk about the registration process, even as we go on.
Okay. So to register, we have divisional offices for registration. However, we have the government has actually put some structures in place to make the registration easy for Lagosians, so that we won't need to go through stress. I'm here to get registered. For those, definitely after the program, I'll be dropping my number for those that want to register. But for probably those that want to probably check our offices, some people want to see those they are dealing with.
Yes.
Let me see the office and let me probably have 1 or 2 interaction with them before they go ahead. We have a V-booth in K2 bus stop.
Yes.
Right at the K2 bus stop, there's a V-booth for LASHMA for people to come and register for ILERA EKO. Probably if you think you want to use the offices and probably you could not access allow start due to distance and you start around K2, can you actually use K2 V-booth? We have officers there which we can help with your registration. Also, we have in Sabo Market Ikorodu. Also, we also have a V-booth there for people that stay around Ikorodu to quickly access for their registration if they can't navigate our head office yet. For that. So they can easily go there, get registered, have the policy, they make payment, and they can start having access to care. So also we have in that same Ikorodu we have outlet officers with kiosks in Ijele General Hospital as well. So the people can also walk in there to do their registration, have the policy, and have access to care from the following month. Also, we have in Sabo Market, Yaba, we have a V-booth there as well, which people can easily walk in, get registered, have policy, make payment, and everything is there to do. They don't need to even stress themselves. We have people there that will attend to them. And also, we have an Ayetoro Market in Ekpe. Now, people can as well use there. It's a V-booth which people can easily visit to have access to register and have the policy. However, we also have divisional offices. It's also meant for registrations. So we have Ikeja divisional office at Ikotun, Igondo. So people can also walk in there to get registered. We have Badagry, Ojo local government secretariat, Ojo. People can walk in there to get registered, have a policy, and start having access to care. We also have Ikorodu West local government. That's along before Agric. People can walk in there too. People are always there on standby on a daily basis for probably physical registration and all that. Also, we have Lagos BRT terminal Aja. We have is also a divisional office too, for people to come and register and have a policy. We have Ekpe opposite legally adjoining the magistrate court.
Yes.
Okay, Ayimbo. For those that stays in Ekpe, so they have about 2, 3, 4 places within their locality to register and
accessibility
and however, whoever that will probably want to register through me, I have my contact here.
Let's have your contact.
All right, 080.
Yes, 080
24 11 74 42. Yeah, it's my active line, it's my WhatsApp. So whoever that want to register, they can easily probably send a DM. Want to register? We send information to them. They don't even need to come to the office.
So what do they need for registration?
So for registration, apparently we only need their biodata.
Biodata. Do you need my
surname? All those are optional. Yeah, it's optional. So just your surname, first name, other name. You have date of birth, state of origin, hospital of choice. It is very, very important. The hospital of choice is very, very important. So we don't just fix them anywhere. So hospital of choice, home address, phone number,
And all that.
and probably the
Those things.
pictures. Yeah.
Okay, the picture. What if I don't have a passport with me?
It's very important we have the picture. They can just take a picture on their phone, if a nice one, so to say, and send to us. You can use it. You can upload it for them.
Okay.
So
Great. Okay, so of course we know our mummies and daddies, the elderly ones. A few of them might not be so tech savvy. Is there any arrangement for them, like any way to help them out while registering?
Okay, so then we can tell them to walk into any of our vehicles.
Okay.
Yeah, for their registration and payment. We have people there. We have POS there for people to help them with their payment.
Oh, POS.
POS,
So
yeah.
don't do cash.
No. We don't accept cash at all.
Okay.
Our payment is via our payment link. Use the back, or you use the V-Boot. Even if you're using the head office for your payment, you don't still go with cash.
You don't go with cash.
No. We don't accept cash. We have a payment channel.
So I pay today being the 13th of October, I get registered and I pay. How soon can I start? Can I walk into the hospital to access care?
Actually, to be okay, what happened is we actually have a deadline for payment.
Okay.
Does not mean you can't make payments, but we're looking at the activation period.
Yes.
Now, for everyone that registered this month,
Yes.
or probably 5th, just as I said on the 13th,
Yes.
will be active from the following month.
Okay.
From the first week, or let me
Okay,
say from the
first
second week to the following
okay.
month.
Second week in the following month. Okay.
From on the 8th,
Okay.
then your plan will be active.
Okay.
So for those that will be active that first week of the following month, they have grace to make payment till 15th of the current month.
Okay.
Like this month, you have
Yes.
grace to make payment between now till 15th of till 25th
okay.
of this month.
Okay. So
Once you know you make payment
any
between now,
payment made before 25th will ensure
definitely be
that I
active.
access.
Yeah, from the following month.
Okay.
But
okay.
but any payment from 26th,
Okay.
I'm sorry, it's
might
gonna
not
be
work.
No.
All right. So one more time, let's just have those numbers to reach for more information, and then your number to even as we wind things down.
Okay, so we have the active customer service, 24
Yes.
hours customer service line.
24 hours.
Yes,
So if I call this line at 2 a.m., somebody will pick up.
definitely. Someone will definitely pick up.
Okay.
Yeah, it's 24 hours customer service. So 091
091
69
69
18
18
59
59
20.
20
Okay, another one is 070
070
40
40
27
27
70
70
29.
29.
These are customer service line to probably make inquiry, or probably you have a complaint to lodge.
Okay.
But if you want to register, my
Yes.
number is 080
080
24
24
11
11
74
74
42.
42
Again, 080
080
24
24
11
11
74
74
42.
42.
My name is Oladapo Olafimihan.
All right. And just tying it to that, any final remarks to Lagos residents concerning ILERA EKO?
Okay, so I will urge every Lagosians to, there's this saying, health is wealth.
Yes.
So I want to advise everyone to ensure they have a policy, coupled with the fact that it is now an act, an act in Lagos State that every resident
It's not mandatory.
It's not
We
mandatory.
spoke about that last
now
time.
to ensure they have the Lagos State health insurance scheme. Aside the fact that it's compulsory, health is wealth. So I will urge all Lagosians to quickly rush to our office to ensure they have a policy, so they could have access to health care anytime. And also they renew every month to ensure them have access to health. We never can tell. Thank you very much.
Never can tell. All right, it's been an amazing time on the show. Thank you so much, Mr. Oladapo
Thank you, sir.
Olafimihan. It's been a great time with you on the show. Looking forward to having you on other editions of the show. Do well to connect with him or any of the numbers he reeled out, or perhaps just go to any of the locations and get yourself on board. Of course, the head office, LASHMA head office, is just opposite the Lagos State Secretariat. Good Shepherd House. Yes, right here. At the Alausa Secretariat, yes, right here. As we round things off, remember that health is wealth. Investing in your health is investing in your future. Don't wait until it's too late. Come on board today Enroll on ILERA EKO today and secure a healthier tomorrow for yourself and your loved ones, for those you love. Visit the LASHMA website. Okay, that's another way to come on board, or any of the enrollment centers. You can also call the numbers for assistance. Somebody will be on hand to assist you. Thank you very much also to Adenka Gwingwa, the Assistant Director, Public Affairs of LASHMA, for her collaboration in bringing this episode to life. And thank you for tuning in to ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. My name is Akan Usen, saying until next time, stay healthy, stay informed. Bye for now.